This presentation will review HIPAA and high-tech rules and regs. HIPAA is the Health Insurance Portability and Accountability Act that was put into place back in 1996. High-tech is an update to those privacy rules that is health insurance or Health Information Technology for Economic and Clinical Health Act that was initiated back in 2009. The HIPAA privacy rules requires protection of a person's PHI or personal health information, regardless if it is an email, it's a piece of paper, or it's a conversation. We need to make sure that we are keeping patient information confidential. We also need to give a notice of the privacy rules to patients on admission. A copy of those privacy rules can be found at any of the offices. A notice of the privacy rule informs the patient how we are going to use their information. For example, we're going to use it for healthcare treatment and also for payment. We're going to submit information to their insurance. We also are going to, talk with their physicians for their healthcare treatment, but we also may need to notify the health department if there's a communicable disease that we need to report, notifying funeral homes, or we may use a limited amount for fundraising, if, for example, sending them information on different donations and memorials that we are doing. The HIPAA rules cannot prevent the agency from providing care to a patient. That is it's not to be a barrier, it's just for the agency to make sure that we are doing everything in our power to keep patient information confidential. If there are any kind of violations to that, Pam Bowman is our privacy official. Disciplinary action that could occur could be just a verbal, don't do that again, this is a HIPAA violation, or it could be as severe as termination if it is a severe violation. High-tech, again, was an update to the HIPAA regulations. It involved increased scrutiny of anything that we do with a person's personal health information, encryption rules and regs, also stiffer penalties, increased funding for audits. So you definitely want to make sure that we are following good HIPAA practices. With high-tech, we had to update policies and procedures to incorporate breach. And a breach is an unauthorized acquisition. It's accessing a patient's information when we really had no business accessing that information. Or it could be more severe as our system was hacked into and multiple patients' information was basically unsecure. We do everything that we can at Save the Heart to make sure that patient information is secure. Our laptops actually do not have any information downloaded onto them. You will notice as a volunteer getting information maybe through the email on patient information that it is password protected. And so that we are making sure that when we're sending out information, whether it's electronic, it's verbal, it's on paper, that it is in a secure fashion. A breach, again, could be maybe emailing patient information to a family member, but it didn't get encrypted, and so that patient information just went out to anybody, it could have gone to the wrong Yahoo email, and now that is a breach. Or someone talking to the neighbor about the patient's medical needs. If that neighbor is not on the HIPAA form that we can talk to them, then that is a HIPAA violation. Or again, if a computer that has patient information is stolen, or our system gets hacked into and multiple records are stolen, we would have to notify those affected individuals, much like many years ago when Target was hacked into and people's credit card information was stolen. Then, if you had shopped at Target, then you got a letter saying, hey, your information may have been compromised. And so we would have to do the same, as well as notifying the Health and Human Services if it was more than 500 patients involved. So with HIPAA, and high tech, we want to use caution when discussing patient information if we know that there's visitors present that may not be on the HIPAA list. If we're in informal meeting areas such as lobbies or front desk area, hallways, when we're using cell phones, for instance, that may not be the most secure. And with texting, if we are going to be texting any type of information, we cannot use any identifiable patient information. I cannot say Jane Doe in Arcanum needs, more diapers, or it needs to be, patient 5467 needs diapers. And we can communicate, and it is the preferred way if we're going to be texting to whoever we're sending that text to, just using the patient's medical record number, and that is not any way being able to identify that patient on the outside. Other ways to secure, again, with computers, logging off, using passwords. Also, any kind of printed patient information, we just want to keep that out of sight. So if you're carrying face sheets, any kind of demographic information for the patients, we want to make sure that we're putting that in a folder and keeping that secure, that if you're keeping patient information at your home, that it's not just laying out on a desk. And then if we no longer need that information, the patient has been discharged, they've passed away, then that is placed in a shredder. Each office has one or more shredders that you can bring information into. If you have a personal shredder at home, that's acceptable. People have asked me, can you burn them? I have a burn pile, or I have a burn, barrel. That's fine. You just cannot just wad that patient face sheet up and throw it into the trash where anyone then could pick that patient information up and read it. So you want to transport patient information carefully. Don't leave documents out in the open. Again, keeping patient records secure or locked in a special place, and only share information about a patient with those people that need to know. So for example, a nurse or a social worker for that patient probably have a higher level of need to know, especially as a case manager nurse. They need to know a lot about that patient because they are responsible for that whole person's care, versus being a volunteer, I may not be privy to all of the information, and I don't need to know all the information in order to socialize with the patient. As well as staff need to secure any kind of electronic devices so others cannot view any kind of patient information. Lastly, with HIPAA security, getting any kind of emails, attachments from unknown sources, downloading different kind of internet software cannot be done without our computer specialist approval. So we would need to contact Jeremy Bailey and get approval before you would download anything onto a computer. If you're not sure about getting an email and the attachment, the best advice is don't open it. So thank you very much.